name is Ntabiseng Noqondo Tlaka. I'm 27 years old and I'm from Pretoria in Mamelodi. I'm a student, also a graduate, and currently working as a billing administrator. So the beginning started in 2015. I think it was in April. I was still working at a private school in Silverton. So I started getting sick. So like the vomitings, my feet being very painful, and everything was just going wrong, you know. I remember the first doctor that I visited was a private doctor in Silverton. So when I got there, they didn't really do any tests or anything. They just said I should just take pills for heartburn because that's what he said I had. So I went home and still nothing changed. Visited another doctor, and they also said I can't remember what they said I had, but they gave me treatment. So I remember it went by and like 3 weeks passed, so I couldn't go to work. So I was home trying to get better. So I didn't know what was happening, you know, so it was a very confusing phase in my life. I also did some tests by myself and they came out negative, right? So when I visited doctors, I knew in my head that no, I'm not pregnant, you know. So the first thing I remember one doctor asked me was, "Are you pregnant?" And I said, "I don't know." But he did insist on getting the test done, but still he confirmed that nothing was like I wasn't pregnant, right? So that whole experience, I really wanted a baby at that time, you know, not only for myself but also for my partner. So yeah, it was just very dramatic, and me telling this story now gets me really emotional. And yeah, so we didn't know that we were pregnant at the time. We wanted help from the professionals to tell us and confirm it, but they couldn't do that until it was too late. I decided that I need to take it seriously and see like a doctor in a hospital. So I visited Mamelodi Daycare Hospital. It's in Mamelodi. And when I got there, they said to me that so they did their test, but also they didn't find out that I was pregnant. So I was discharged to go home. You know, they gave me pills. And I remember when I was leaving the hospital, I had to be taken out on a wheelchair because my legs were not functioning at all. So like we took it lightly because like we just thought maybe I was too tired because I wasn't walking for a long time, and that's why I was just very exhausted. And got home, still didn't get better. Again, I went to other doctors, and I remember the fourth or fifth doctor that I saw, that's when they confirmed that I was pregnant and I had a miscarriage, you know. And they said the miscarriage was between like the first trimester, so that was like a few weeks back. So I lost the baby like weeks ago, and nobody knew and nobody did the test. So that's when they rushed me to another hospital in Pretoria. It's not a private hospital, it's a government hospital, where they checked and I had to get the baby taken out. You know, it was a very traumatic experience. So I went to a private doctor, and they simply said they didn't know what was happening. So they wrote us a letter to go and see a doctor at Tshwane District Hospital. So when we got there, that's when they figured out that no, it's really something serious, and I needed specialists to take care of everything that was happening. I was taken to Steve Biko Hospital, and that's where we saw some light. So when we got there, we met a professor who confirmed that I had pneumonia, and I also had, I forgot the other diagnosis, and also confirmed that I had Guillain-Barré syndrome. So I had to do a lot of research on it because also it's a very rare condition. Not a lot of doctors know about it. So Guillain-Barré syndrome is when your immune system attacks your nerves. So your nerves weakens and you lose function of whatever limb or whatever body part that has nerves moving. So I lost mobility for both my limbs. I couldn't walk and I had to be incubated in ICU. So also with Guillain-Barré, you can only get treatment for it. So the best treatment for it, it's physio. That's how you can regain your strength. And so a lot of doctors don't know about it, especially doctors in the private field, up to this date. Like if I visit a private doctor and tell them I have Guillain-Barré, they would say we've heard about it, but we don't really know how to treat it. So I got wheeled into Steve Biko, and I was immediately incubated. So I couldn't talk. So when you're incubated, they block your voice, so you're not able to talk, you're not able to move. So we're just lying on the bed, and I remember seeing different doctors standing on the side of my bed, and they all, like they were talking to figure out what was really happening with me. So one professor then confirmed that no, I think she has Guillain-Barré syndrome because the weakness started from the legs going up. It didn't progress from top going down. So that's how they diagnosed me. The following day, I was wheeled to ICU, and that's where I spent 91 days on the machine. So during that 91 days, I couldn't feed through the mouth. So I had to get a tube that went through my nose. Sometimes it came out, they had to insert it. It was a very painful procedure. And I had tubes all over, like my mouth, the nose, the neck. I had drips on my legs, drips everywhere. And I used to, they used to put me the catheter, because obviously I couldn't move around, right? And yeah, it was very traumatic. The staff was really nice. So the nurses would also come and chat, the physiotherapist, the psychologist, and everyone else was just really nice in ICU. And I remember just after leaving ICU, after the 3 months, I got a chance to go outside. So I stayed in ICU without seeing anyone. Like there was no window, there was nothing. So you could imagine how hard that was. And I went to high care. So that's when I started learning how to eat again. So even there, I had someone from the government training me how to swallow, how to sit on the bed, how to remove my neck, and how to eat, how to hold the spoon and everything. And so after I went to the normal ward, I would really get nice treatments from the physiotherapist. Would go out to have lunch at the cafeteria, and also I would get sessions where I would swim and have other treatments. I remember at some point we did my nails, we did my hair, so I really had a great time in the hospital. And when it was time for me to get discharged, they offered me the services for SASSA. So that's when I applied for SASSA and everything, so that I can be able to take care of myself at home. And also they did home assessment. So they checked if I'll be able to move around at home when I get discharged. And also they gave my mother, the assistant, I forgot what it's called, but they gave her an income because she was looking after me. Also after that, I never got discharged straight to home. So they referred me to another hospital where I'll do my physio, where I was doing my physio. So physiotherapist, it's a hospital called Tshwane Rehabilitation Center. It's just close to Tshwane District Hospital. So when I got there, I still couldn't walk, but I was there obviously for physiotherapy, to regain my strength and to learn how to walk again. So that whole experience was really painful because remember, I didn't walk for over a year, and now I had to start walking like a small baby, small steps, learned how to sit, stand up, use the bathroom, how to brush my teeth, how to brush my hair. So all that process took me, I think, 6 months to learn. And I would go home on weekends, and I had really, really nice therapists. My physiotherapist was always so understanding of my pain and accommodated me reasonably and treated me how according to like the pain that I could take. And also my OT also did an amazing job. So my fingers were like this, right? So the OT had to accommodate me and ensure that my fingers get straightened again. When I left hospital, I had so many opportunities. Wow. When I gained strength on my fingers, so I was offered an opportunity to work as an intern at Mamelodi Hospital. And the next hospital I went to was another clinic at Mamelodi. And there as well, I worked with management. So I did all their bookings, like the systems. I updated patients' profiles and also dealt with a lot of negligence situations at the hospital. Then I moved to Steve Biko Hospital. So here I was not admitted, but I was actually like a staff member. As a staff member at Steve Biko Hospital, I worked in the public health department where we were doing trainings on upcoming diseases like the corona and everything. So we did a lot of research and shared that with public servants in the hospital. Then after that, I worked in the IT department. So I was doing information systems for the department and also getting information on patients and stuff, so that we get all the right records, for payments and everything. And overall, my experience with the government has been very excellent. I've attended clinics, so after being discharged from the hospital, I had to go back for clinics, and I've been a patient there. Whenever I have problems, they do assist me. If I go there and ask, no, I'm having problems with my eyes, they would, suggest that I get glasses or anything. So everything is really well. So to my doctors, Dr. Rapala and the team in the neurology department, thank you so much for saving my life. You've done an incredible job, and I know that you're doing a great job also with other people. And to the health department, I would like to say that don't just finish off with me, but please continue serving others and ensuring that they get right treatment. Wow, it was really like the public sector is really doing a great job, I don't think I was ever going to recover had I went to a private, because obviously I don't even afford going to a private hospital, but I don't ever regret going to the government. And also I thank them for opening up and wanting to serve and helping people like me.